샛별
Are a woman experiencing urinary incontinence, vaginal dryness, vaginal laxity, or pain, you are not alone. These challenges can show up at the most inconvenient moments, holding you back from the activities you love. And sometimes they even affect your closest relationships and your confidence. At Sunshine Health, we offer Empower RF, a gentle, non-surgical treatment designed to rebuild and restore comfort, intimacy, and confidence. With personalized care and advanced technology, we guide you every step of the way. Empower RF helps women regain control, feel confident, and embrace life fully. You deserve freedom from worry and to feel like yourself again. Take the first step today and learn more about this technology here at Sunshine Health DPC, Thursday, September 25th at 5:30 p.m. Register at sunshinehealthdpc.com. Greetings, everyone, from Sunshine Health DPC. This is Priscilla Bullen, and I am the founder of Sunshine Health DPC. I am hosting tonight the fabulous Dr. Ordonez for talks all about what DPC is here at Sunshine Health. Now, Dr. Ordonez, she was the valedictorian of her medical school class at Our Lady of Fatima University College of Medicine in the Philippines in 2002. She also completed her residency at EVMS, Ghent Family Medicine Program in 2006, where she received the Isadore Marmon Outstanding Resident Award. She's been practicing for 16 years. Thank you so much for joining us, Dr. Ordonez.
Thank you for having me. I'm excited to talk with everyone and help everyone to learn more about DPC.
And that's direct primary care. All right, everyone. So we are going to set the tone, and we're going to talk about just a couple of statistics, not too boring here. This will lead into the reason why we're talking about direct primary care. So the GDP in the United States for healthcare is at 17%. That is the most that any country spends per capita for healthcare per person. And our outcomes do not reflect. They are actually pretty poor. In comparison to Japan, and there's many other countries in the list, and you can look this up, but just for an example, Japan spends 9.2% on their GDP, which is about $5,000 per person per capita, and their outcomes really shine compared to ours. So we're going to talk about what direct primary care is. So Dr. Ordonez, can you give us an idea of what is this direct primary care?
Yes, well, DPC is a very innovative way to deliver medicine. We all know fee-for-service, insurance-based practice. This is not an insurance-based practice. It's direct to the patient, one-on-one, no insurance, no middlemen. It helps us to deliver care in a monthly membership model, so we get to take care of people. It's not a sick care model, so it just is a better way to deliver care, both for patients and also for the physicians who take care of patients.
Yes, I love that. So not sick care. So we don't just see our patients when they're sick. Right. We see them to prevent illness, and we help them to extend their wellness and their health span.
Correct.
Way different model.
Yes.
So typically patients in traditional settings might go for their annual physical, and they get very minimal things done. But for you would see your patients probably more holistically and regularly.
Correct. It's very thorough care. You can go every body system. You're not tied into a very small 5-minute visit where you're just waiting for an hour for that 5-minute visit. It's really the total person, not just physically, but emotionally, mentally, sometimes spiritually, if the patients need that. But a very comprehensive care.
It is, and we're going to talk more about that. And so our next topic is what we're going to do is we're going to give you some comparisons from traditional care and direct primary care, and how direct primary care truly benefits patients. So just for a little game, we're going to speak about traditional primary care. So in 30 seconds, me and Dr. Ordonez are going to just think of one word that describes traditional care, and JD will keep us on time, right? Okay, so, go ahead.
Expensive.
Time.
Frustrating.
Waiting. Bills.
No transparency.
No answers.
Yes.
Okay.
Consults forever.
Referrals.
No.
Okay, so now let's talk more in depth about the problem with traditional care, which myself and Dr. Ordonez have worked in, both fee-for-service, and then I did work in value-based medicine, and Dr. Ordonez worked for the VA, which is a different model than fee-for-service. So as far as for me, my face-to-face time with patients, if I didn't work less than I was paid for, so I never worked at the end I didn't work a 1.0. I'd work maybe a 0.6, so I can space my patients through the day, but it was still very hectic. But typically, when I was a 1.0,
maybe 5 minutes in front of my patient to see what their problem is, organize my thoughts and their thoughts, diagnose, and give them some kind of solution before I go on to the next patient. Patients often complained about their bills and how much their labs cost, and I had no idea like how to fix that.
Right.
So what are some other things that you have dealt with traditional primary care?
Just if they had to have multiple issues, they had to come back again for another appointment. So it's very just not convenient for a patient to be able, waste of time just to make another appointment. But if you can only address one or two maybe problems with your physician, it's not good for the patient. And then when you're leaving grabbing for the door, the patient's going to say, oh, by the way, I have chest pain. And you can't just ignore when they say, oh, by the way, I have chest pain. So
yes,
a lot of patients complain that physicians are always late. They wait an hour or two, but really, it's not something the physician wants to do. It's something that they're trying to take care of the patient before you, and that puts them behind because they don't really give physicians or clinicians enough time to really spend with their patients. They give you that 5 or 10 minutes. Sometimes we will even double book, and that sacrifices our lunch breaks and that sort of thing. And it's a moral injury in a way for physicians in the current fee-for-service world, where it's that churning patients in and out.
I love that term, moral injury. It is. And I don't know about you, but I really didn't have control over my schedule with my patients.
Correct.
In that setting. Yeah. Now, on the flip side of the coin, too, we're talking about a little bit of both, how providers and patients are frustrated. But from like a provider standpoint, to have to work every day seeing patients back to back throughout the day, not missing your lunch break. Maybe I haven't even urinated that day or hydrated. And now I have like 50 messages at the end of the day and charting that I have to finish.
Right.
So I assume that was your experience too.
Absolutely. I think they always say you have to always be prepared, at least in primary care, to spend 2 or 3 hours outside of actual patient face-to-face time to take care of everything else. The prior authorization forms, other non-urgent issues, it just keeps on going. And so physicians are tired, and you want your physician to be at the very best, because how can they be creative and innovative in your management if they're just exhausted with their day?
Yes, exactly. And then the coding has to be, that's more administrative and paperwork. And you just want to take care of your patient.
Absolutely. People go to school for 4 years to be coders, and they expect physicians to be able to code on top of what they do medically.
Right. And then again, with those referrals, when patients have to come back to the clinic because I can't address your second or third or fourth problem, another copay for the patient, another copay for the patient. And that's how those models work. They work in volume, and they want as many patients in and out, and they do want more visits. So that benefits the organization, not the patient. Yeah. So that is why statistically, over 65% of primary care providers report burnout. However, I believe the number is higher. That's just reported.
Yes. I'm pretty sure if you just poll all physicians or clinicians involved in primary care, it's 100%. Maybe when you think about some of the subspecialties, maybe they're not as burnt out.
Right.
Because in primary care, you're responsible for your patient really from birth to death, and it never stops. We care about our patients all the time, and so we always think about our patients, or at least I do. Even when I go home, I just want to make sure I did the right thing for them and provided the very best care for them. So it's exhausting.
Yes, absolutely. And then just as a reminder for those jumping in and out of the episode today, you are on a webcast with Sunshine Health Direct Primary Care, hosting Dr. Ordonez from My Doctor DPC, or Direct Primary Care, right on Virginia Beach Boulevard. So we're both in Virginia Beach talking about how DPC benefits our patients. And so on to the next point. So we're going to talk about how DPC benefits our patients. So we can, and again, in 30 seconds, one-word answers. Let's try to say as many one-word answers that DPC does. Go ahead.
Affordable.
Wellness.
Accessible.
Helpful.
Did you say wellness already?
Preventative.
Preventative, yes.
Sunshine. Comfort.
Yes. Flexible.
Adaptable. Access.
Yes. Transparent.
Yes. Pricing.
5 seconds.
Okay, one more.
Fun.
Yes, for both.
Yes.
All right, awesome. So now we're going to delve a little deeper on how direct primary care works. And each direct primary care clinic may be a little bit different, but a lot of them run on membership fees. So you have a monthly membership fee. And for instance, for your direct primary care, what does that fee give those patients that come to you?
So pretty much it's unlimited access in the sense of visits, whether it's in person or FaceTime, phone calls, texting, and accessibility even after hours. It's just a way to keep you healthy and not waiting until the next visit until you address your issues. We never let anything build up, and very proactive basically, and includes other things as well as like EKGs and other types of procedures that are
like included.
Included in
with
that
the visit.
So if a patient needed a pap smear, the actual exam itself is included in that.
Right.
Mm-hmm.
So that's similar. That's the same as us. We'll check an EKG. We always get baselines. We don't have to charge for them. We just do them. I want to see where you start out, even if you're feeling okay today. We have body composition testing, which is very helpful to see exactly where a problem or issue may lie. In our clinic, we do have the IV infusion and peptide infusions as well. But like I said, every DPC has different things, but very similar services like doing your pap smear. It's not going to be an extra fee, an extra charge, an extra visit that day. So that's really, I think, very beneficial for patients. And then the time of your appointments. What do your appointment times look like?
Well, oftentimes it's at least an hour. New patients often get 2 hours. I have had it where if my schedule allows and a patient has not seen their doctor in 5 years or so, I have spent 4 hours with a new patient before because they needed it and I had the time to do it. And, I think you do what's right for the patient at the time that you're seeing them, and DPC allows you that flexibility. So
it does.
But typically an hour is usually for follow-ups, and physicals can take an hour and a half, sometimes even longer if it's a senior citizen who needs a memory test. So I'll do dementia screening and that sort of thing. That takes a little bit more time.
And you can actually do that test yourself.
Correct.
And get that firsthand feel with the patient, and not have a different staff member do that for you, give you the numbers, and then you figure out, okay, this is probably how it is. Those are just numbers. But when you actually work through that test with them, you can see the deficiencies lie. Yes, absolutely. So our clinic is the same. We typically take an hour with each patient, because that hour you're talking about, well, first, you can talk about your life and your family, right? And their family a little bit. And then you get into, the topic and what journey you're on. And our new patient visits are usually about 90 minutes. But again, if there's this long list of things and history and records to review, that can go longer. There is no other place, concierge medicine, but that's also a different type of field too. But there's no other place that you will have an hour with your clinician to talk about your issues in depth. Absolutely. Besides direct primary care is my feeling with that. In addition, so let's talk about the in-depth evaluations. We talked about like doing memory tests, but like for my body composition testing, I can pull up the last 3 over the last 3 months, and we can look in depth on how that person's body composition is improving or not, or whatever the issue that we're dealing with, step by step. And that takes time. I couldn't do that in traditional care.
Right.
Absolutely not. And so some other in-depth evaluations you may do that you could not do in traditional care. What are some of those things?
I mean, sometimes I can figure out the problem by just asking the patient to walk me through their day. What time do you wake up? What are you eating? What are you drinking? How does that stool look? Is it a Bristol type 1, 2, 3, 4, 5? So I'm
Here's the card.
Yeah,
and that's what it looks like.
I always whip out my stool chart and say, what does it look like? So very meticulous about going through their day to day and what their intake is.
Specifically,
Like give me the details. So you would never ever be asked that in a traditional primary care fee for service because they only have 5 minutes, and that in itself can be a 10 to 15 minute discussion about what a patient's day looks like.
Right.
So
and when you have that time to talk to your patient about walk me through your day or walk me through your week, especially in relation to a symptom, sometimes they actually just give you the answer.
The diagnosis is there, and as we know in our training, the diagnosis is in the history and the physical. And I know this is the day of medicine where we use technology and MRIs and CTs everywhere, but that's not really cost effective, and that's why the United States spends so much money on healthcare, is because all of these tests and imaging, it's
a lot
expensive.
unnecessary.
Yeah, it's unnecessary.
Yes.
The answer, the patient will give it to you.
Absolutely. Totally agreed. And what about your relationships with your patients now versus before, which I'm sure your patients loved you and you had the best relationship you probably could with your patient with the 5 minutes or
extended,
yeah. But people had to wait to see Dr. Ordonez, and they'll wait.
Wait. But yeah, it's definitely a flip now, because before, if they had to wait an hour or so to see me for their 20-minute visit or so, but now it's the opposite. They may wait a few minutes and then they can spend that hour or more with me. It's definitely it's more relaxed also, because you don't feel that like your doctor is trying to get you out of that door and rush that appointment. It's a very relaxed appointment.
Right.
Patients appreciate that.
I love that. Relaxed. It's fun. Coming to work is so fun.
Yes. I mean, my patients are taking off their shoes. They're crossing their Indian style and getting really comfortable.
Yeah. My patients are getting tea, and they're like, "Oh, can I get another one? And can I throw my bag over here?" And it's fine. It's
very relaxed.
It's like family style. Yes,
exactly how
I love it.
The way I thought medicine would be, where it was relaxed.
Yes, how it should be. A relaxed patient is a better conversation and communication with your patient.
Correct.
Now, on the flip side of that, from the provider side, can you discuss some really great things in your life with your family, with yourself, that has changed since becoming a direct primary care provider?
Oh, definitely. I now have a life outside of work. Yes. And then you can almost see my progression in my own health. As we were talking about it earlier, when I started this during the pandemic year, I was probably one of the most unhealthy I had been. And now that I have time to have my own self-care and enjoying life and making time for exercise and making it a daily ritual instead of like a weekend ritual. But yeah, it's such a blessing to be able to create a schedule that my family can see me, and I'm present for all of the big events, and I can make everything happen. And I feel like I can have the best of both worlds, career and family. In this practice.
That's everything. That's amazing. Even physically, you have changed. As you just mentioned, talking before we started the webcast, that you lost weight and you are just healthier, probably more energy and everything else, and vitality. That's everything. Yes. I agree with that as well. Some of my hardest times in my life were when I was working traditional care nonstop, and I was working a 1.0 full-time, horrible health habits, horrible lifestyle habits, and it just happened right in front of me without me knowing it. And then it's just like, oh, something's got to change. Right. Something has to change. Yeah. So providers, it's such a beautiful model as well. Yes. And I will say, so as far as affordability, I tell people about our membership fees. If you go to Starbucks 3 times a week, if you go to Starbucks 3 times a week, you can afford our membership fee. So it is affordable for most people. I understand not for every single person, but for most people, if you allocate your money towards your health, it is affordable.
Well, yeah, you have to look at it as, are you going to pay it now, or will you pay for it later when you're sick?
Right.
Because if you're sick and debilitated, you're going to pay for it. It's going to come out of your pocket in a form of multiple medications, multiple hospitalizations, multiple specialists. So it'll be costly whether you do it now or later in the form of being sick.
We're paying forward.
Yes.
And being sick doesn't feel good.
Correct.
So that's the other downside of
it's not
paying
just financial.
later.
Yeah.
Right. It's everything.
Your family. Your family will be worried about you.
Right. Burden on your family, just, feeling debilitated yourself, all kinds of negative aspects to it. And then just as a reminder for those that are popping in and out, this is Sunshine Health DPC, Direct Primary Care. We're doing a webcast with Dr. Ordonez from My Doctor DPC on Virginia Beach Boulevard. So we are both direct primary care providers in Virginia Beach, and we are hashing out and explaining to our viewers all about DPC. Okay, so a little bit about the future of healthcare and how DPC has grown and how this, I believe, will be the preferred and demanded, hopefully, model of healthcare for people. So what are your thoughts about that?
No, absolutely. I've already heard about premiums going up for insurances, Medicare, and so it's going to be more expensive. Of course, inflation is there. The cost of everything is going up. And so we need to find a way to deliver care, and this is the way you can receive and deliver care in a cost-effective way. And coming into 2026, it's going to be that most, I think, if not all, HSA and FSA can be used to pay for DPC memberships, and so that will be just another tool for people to be able to access affordable and accessible health care.
Yes, yeah, absolutely. And in our clinic, we do have some corporate patients which their employer actually pays for them to have this really wonderful care. And I believe that when more and more people know what DPC is, and when the demand is there, then people have, the employers may start to respond to those things as far as, yes, we also have a DPC part in our healthcare plan. And so that might even gear people to work certain places. And I believe it's going to be something that's more up and coming, like a paradigm shift and a transformation in healthcare, which is going to keep people healthy in the long run. So I feel this is the time.
Yes.
I really do. Once patients go DPC, they don't go back.
That's correct.
So we're going to do a little game. And in this game, we have some questions in this bowl that me and Dr. Ordonez are going to pick and answer, and it's all about DPC. So feel free to pick first.
Okay. Okay, hope it's easy.
Ooh, what did you get?
A patient admits they've been avoiding care because of cost. What's your first response as a DPC provider? Well, this is kind of in reference to that. The cost of care in DPC is affordable. Our labs are basically almost for free, in the sense it's 90 to 95% off. And so
with our special pricing, yes.
Because we pass on that special pricing to our DPC patients. And literally, I have had patients that their one lab visit paid for their entire year of their DPC membership. And in fact, someone had used their insurance and had paid like $1,200 in their deductible. And I converted it and I said, here you go, it's $150. And they had just gotten married. So I said, wedding anniversary for them, because the pricing is really phenomenal.
It is phenomenal.
And you can't beat the savings in a DPC model.
Oh, agreed. A lot of my patients do pay more for their labs going through insurance, including myself. I've done the comparison, and out of pocket, like for instance, my labs were $167, and they really should have been like $42. Ridiculous.
Yeah, when you, as the clinician, know the pricing, you just are in shock when people are paying thousands of dollars for their labs when it doesn't need to be. And then you're not hesitant to draw certain labs because we can afford to do a workup. We can
Yes.
afford to do a proper dementia workup if dementia is on the rise, and there are a lot of things that people are not testing for because one, insurance is probably not paying for it, or they're just worried about that cost.
Right. Good point. All right. Next here. Okay, so my question is a fun one. It says, sell DPC to me like you're a car salesperson. Okay, so I would say DPC, it's like having unlimited miles on your car, but for your health, unlimited miles for your health span. I would say this is your luxury sedan, not your beater.
Yes.
And I would also say something about prevention, kind of like car prevention, having, your insurance or whatever, but it's like that preventative care for your car, but for your health. Yeah.
Absolutely.
Yeah. All right. Your turn.
Someone says, so DPC is like a gym membership, but for health? What's your reply? Yes, DPC is exactly like a gym membership, whether you use it or not. You're paying that monthly membership, but it is to your advantage to use your membership and be seen and have that prevention with it. You don't get penalized for being seen or having issues brought up to the clinician. So it is something that's nice because you don't have to hold on to that, rash that you were going to wait till your next 3-month follow-up. So you can address it. So you don't have to wait. And that's the most important thing is you don't wait when you're having a medial issue.
Right. Where gym membership,
Yes.
I guess that's the difference in a way, but, and then you have access after hours as well.
Yes.
That's another benefit. Nice.
Absolutely.
All right, my turn. Okay. If I have a fun one again. Okay, if DPC were a restaurant, what is on the menu? Okay, so I would say, because we're Sunshine, I would say healthy, Sunshine sliders, the Sunshine Lab sampler. I would say Sunshine buffet. Okay, mine are
That's
short.
good. Yeah, that's good. Alrighty. A patient asks, do you ever get tired of being available after hours? How do you answer honestly while keeping trust? So, it's very important. From the very beginning, I'll always establish, it's important for clinicians to have boundaries too. I say what is an emergency and what can wait. And also that is helpful for patients to know that you are accessible in case they needed help to triage whether or not something is an emergency. So you give a patient peace of mind if they know that they can have access to you, right, and that you're going to respond to them. And they'll be very nice to you. They'll say, okay, I need this refill, but don't answer me until tomorrow, because they know. Because
and sometimes you need to brain dump that too, so you don't forget.
They do. They will just I know it's like 3:00 in the morning, but could you send this refill when you are in the office? But so it's okay.
And then you're like, are you dealing with insomnia that I don't know about? No.
But it's good. It's patients are very respectful because they know, they want you to not be exhausted either.
They want to be a part of this.
They are, because you build such a intimate relationship really with your patients. We know the ins and outs, everything, even deepest, darkest secrets sometimes. And so it's one of those things they want you to do well. And they enjoy it when we're doing well.
And you have more experience with that from being open, is it 2000?
Yeah, 2020. So
pandemic. I meant 2020. I was thinking the pandemic.
Yeah, 2020.
Sorry.
Yeah, no
2020. And we've been open since May of this year. I haven't had any kind of issues with like late texts or after hours or anything like that. You have more patience and more time underway. But I do still feel the same way that my patients don't, we have such a good relationship. They don't like
Yeah.
overstep that
Yes,
kind of
yes.
thing. Yeah.
Yeah, and they know what is a true emergency, and I tell them if you really can't decide, please let me do that for you. I will triage you and tell you, hey, you're not imagining that you're having a gallstone attack or a kidney stone.
Right.
Please, we need to get you to the ER for help if that's, you're about to pass a kidney stone or
Right.
have a acute cholecystitis.
Right. It's like having that
Mhm.
advice,
Mhm.
should I, shouldn't I go?
Yes.
That's usually when that call
Yes.
would
Mhm.
come in.
Exactly.
Yeah. And then should we take one more, JD? Yeah. Okay. All right. All right. So we have, oh gosh. Okay. You just saved a patient thousands in emergency room bills. What is your victory dance? I would say the Super Bowl shuffle, but it's got to be the Sunshine Shuffle.
Oh, okay.
The Sunshine Shuffle. So I have to make a dance up, JD? Oh my God. All right. Victory dance is going to be Sunshine Shuffle. The Sunshine. Oh my God, JD. Oh boy. Okay, one more, JD? Oh, and before we take the next question, I just want to remind everyone, those coming in and out, you're on the Sunshine State of Mind podcast, episode 8, and I'm Priscilla Bullen, founder of Sunshine Health, and I'm here with the fabulous Dr. Ordonez of My Doctor DPC on Virginia Beach Boulevard. We're both DPC providers in Virginia Beach, and we're talking all about DPC.
All right, so here's my question.
So we're doing questions, fun questions about how DPC benefits patients.
This one is interesting because this actually did come through my portal this week.
Very fitting.
Yes, a member shares she's going through a divorce during their visit. How do you support them? So definitely I support them there in the office and kind of see where they are in their state of health. And I'm a spiritual person, so I will tackle it from both the logistics of going through the divorce and the stress of that, but also if they need that spiritual counseling or prayer, I will gladly do that in my office. I actually, for that particular patient, even offered marriage retreat information, and we definitely have access to therapists and counselors. Actually, in our office, we do have a therapist who can help with that as well.
Nice.
But yeah, it's definitely a tough thing, but we're there through thick and thin, and we help them get through it if they're really going to pursue that divorce.
That's a tough time in life.
It's a tough time, yes.
Right, and you have the time to actually listen.
Yes.
And experiencing that in a 5-minute visit is so just disappointing and exhausting, and it's very difficult.
And it's the reason why sometimes their blood pressure is high or they're needing more anxiety medicines is because they're going through that divorce, and sometimes they don't share that with typical fee-for-service world. You don't have time to disclose those intimate details,
and you don't have that relationship, right? So JD, audience check online question 2. All right, so we have a question from the audience, and what is our question?
She's asking, what is the difference between DPC and concierge?
Okay.
What's the difference between DPC and concierge medicine?
Well,
the question is, just in case they can't hear, the question is, what is the difference between DPC and concierge? Very good question.
Yes. So you learned a lot about DPC. So in concierge medicine, they are giving you a monthly or annual fee as well. Sometimes a lot higher, usually $250, sometimes even $1,000 a month for some. In addition to that, you are obligated. They're charging your health insurance as they normally would in a fee-for-service world. So you're getting your copays, you're getting your bills from your insurance. So it can be quite expensive. But I would say that still, time-wise, DPC still wins because we're not paid for the number of visits that we have in a concierge medicine. They still have to get the patients in the door because they're still trying to get the insurance payments. But I still feel like, it's cost effective, but you can still deliver the care in direct primary care.
Right, right. And again, that's where insurance has that hold and that middleman
Yes.
with concierge. And so there's more stipulations and probably things like that nature that concierge medicine has to think about or balance. And DPC is so straightforward.
Yes, there's not much thinking about like behind the scenes. Is this going to get covered? Is this Medicare will deny this?
Right.
It's just a different mindset for the physician. You know, like all the codes you still have to know in concierge medicine because they're still dealing with insurance.
Right, correct.
Diagnostic codes, CPT codes, everything.
And charting as well with their patients.
Yes.
And as far as the time that a concierge provider would have with their patient, I feel like it would be no different. It wouldn't be more, it wouldn't be better, it wouldn't be than DPC, in my opinion.
I don't know that I've seen any concierge doctors spend 4 hours with patients. So I think their schedule would probably be still very packed.
Right.
With their,
that's probably the insurance piece that comes with it, though.
It's the insurance piece.
Yes.
Because if you do accept insurance into a practice, of course, that's going to require about 3 or 4 staff just to go and get that insurance payment back. It's like a lot of people, the paperwork trail is really long for getting your insurance reimbursement.
Coding, billing, it's a hot mess.
It requires a team just to have insurance.
Right, and we don't have to think about those kinds of things. All we need to document about our patients are the things that are important for our patients. We don't have to pull in 15 different codes just to get reimbursed $50 or whatever the reimbursement is, because reimbursement is not really great from insurance in general in that world. I mean, in primary care.
Right.
So that was a good question, though.
Yes, great.
Okay.
Does functional medicine apply to DPC?
Well, I can answer part of this. In my opinion, that's the functional medicine is like a root cause analysis type of way of looking at a patient. It doesn't always mean that a direct primary care provider is going to practice that way. However, I do find that more direct primary care providers, that is part of the reason they go into direct primary care, so they can practice either completely like functional medicine or a little bit like functional medicine, but all in all, it's root cause analysis. And that's why we go into this. But it's not synonymous, in my opinion. What are your thoughts?
Correct. Now, there are direct primary care practices that do have that functional medicine piece where they would pay extra for that service as well, because it just involves a lot more testing and that sort of cost. But in my particular one, I don't practice functional medicine in my office.
So, and we do practice functional medicine here and have access to a lot of those outside testing labs for different types of genetic testing and things like that. And that is another level of having to learn just how to interpret those tests. And not that you can't get those done or do those tests, but it's just, okay, now how do I analyze this test and do right for my patient? Or hormone balancing, which a lot of primary care providers, they don't really know how to do, to that standpoint on how to evaluate your hormones and then balance your hormones. And that's one thing we do here. I don't know if you do hormone balancing as well.
No.
It's like a science of its own.
No,
in addition,
after the World Health Initiative, a lot of the teaching about hormones pretty much died off because we were scared basically to prescribe it, because it was like, no, it's evil, bad, and so the education piece dropped off, unfortunately, and it's such an important aspect of women's health.
But before that, it was more of an integral part of learning in medical school. I would think, and in pharmacology. But yeah, that Women's Health Initiative, it's just, everyone's like, I'm not doing it, I'm not touching it.
Yeah, it was a
that
disservice
kind of thing.
for women, unfortunately.
Right. And women who have their hormones balanced are like, they can feel amazing throughout their whole lifespan, not just before they go through menopause and then like, oh, it's just a part of life, you just have to deal with it. Women can feel better. And it's a great thing, I think, in my opinion.
Yeah, absolutely.
So any other questions, JD?
Not right.
Not right now. Okay, so now just to talk a little bit about the other things you do in your clinic, because our clinic does other little ancillary things too. What other aesthetic or weight loss things or creative, other outlets do you have at My Doctor DPC?
So we do aesthetics medicine as well, more energy based, meaning lasers, radio frequency, microneedling. We have a Morpheus 8, an Alma Harmony XL Pro laser. And my favorite thing to do is hair restoration or regrowth through a Keralace MD. It's from a Lutronic Cynosure product. And basically we're doing the laser, and that introduces the opening to the hair so that you can introduce these proteins that are wrapped in nanoliposomes that get absorbed into the stem cells. And so we get this great result of hair growth. It's so much more effective than PRP, platelet-rich plasma. It's like the injections are very painful, but this is not painful. People will actually fall asleep during this procedure.
During the treatment.
It's my favorite thing to do because especially for
That's
women,
awesome.
postmenopausal or people who are using weight loss drugs and they are losing hair because of that. So it really applies. I mean, you would expect more men, but actually women are the ones because it's our crown. And so it's something that I think women enjoy doing that because they see great results.
Yeah.
And it's sort of like getting a hair massage for an hour or so.
Oh, I love it.
Yes.
I love that you love it.
Yes, it's my favorite thing to do.
I enjoy my procedures as well. It just like kind of breaks up the day, and it's a fun thing to do. So we might have to barter some of our services. We also do aesthetics, and we do the fillers, the PDO thread lifting and Botox here, peptide infusions. We have the Morpheus 8 as well. And we also do vaginal procedures to help women with vaginal laxity, urinary incontinence, and vaginal dryness without any medication. And we actually have an event tomorrow night at 5:30 here at Sunshine Health DPC. So you can go to sunshinehealthdpc.com to register at 5:30. And it's education to learn what else can you do to improve your vaginal health, your intimacy, all of that. So please feel free to register for that for that event. And we also do peptide therapy here too, which can be vitamins or some peptides, either injections or within in an IV infusion as well. So we'll have to barter some things,
Yes.
I believe.
I have a question for the audience.
Yes.
Does this aesthetic procedures included in the membership or?
No, it's an a la carte service, but we do give our DPC patients a discount. Of course, there's consult fees, but we waive that also for our DPC patients. But there's usually discounts or promotions that we will give to our patients.
Yes, yeah. Same with our practice as well. And so the question was, are these services, the aesthetics, just in case they didn't hear JD, are they included with the DPC membership? And we do the same thing. We give our members a very generous discount because all of these other things, they cost money, whether it's a product or using the, like your laser. I know that costs money every time you use it, or pieces, a product.
Yes.
I mean, all of this, it costs money. So, but we give a generous discount. So if you're going to look into doing these other ancillary aesthetics in another place with a provider that doesn't know you versus doing it with your own provider that knows you, it's a no-brainer and you get a discount. So we do provide that same discounted services, but it is a cost.
Yes.
Yeah. Any other, JD? Okay. All right. So anything else you want to share about DPC or anything else just in the world?
Just give DPC a try, just because it is, once you do go to DPC, you will not go back to any other form of service. We give great service is the most important thing there.
And I think it's once you go DPC, you don't go back for us as well, not just the patient.
Yes, that's true for all clinicians.
Yes.
If you are burnt out, that DPC is a good option for a lot of people. And one DPC is always going to be different from another DPC. That's the beauty of it. You can create your dream practice however you want to do.
Yes, you're right. That has been so much fun creating this business over this past year, for sure.
And it's always evolving. Your business will look different from year to year as you evolve in your knowledge and things that you're passionate about.
Yeah, absolutely. Absolutely. So just a little wrap up here. Thank you to all of our viewers who have jumped in at any point. I hope that you have learned something about direct primary care, and you can spread the word to other people that this is a thing here in our community in Virginia Beach, in Hampton Roads, that our community can take or partake in. Also, I would love to thank our producer, JD Alcantara, who is our office manager. He is also the logistics man, the IT guy, the finance guy, and everything else, social media guy that helps this business do what we can do for our patients. So thank you so much, JD. And lastly, but not leastly, thank you, Dr. Ordonez, for spending time with us tonight to educate our community about what DPC is and how it benefits patients. We really appreciate you coming here and hope to see you again.
Yes, thank you. And if anyone wants to check out my website, it's mydoctordpc.com, and we're on Virginia Beach Boulevard in Virginia Beach, Virginia.
Yes, thank you all. We hope you have a wonderful night.
Take care.
Sunshine Health DPC. I'm Priscilla Bullen, and I'm so glad that you're here. At Sunshine Health, we believe healthcare should be personal, peaceful, empowering. That's why we created a space where you're not just a patient, you're a part of our family. At Sunshine Health, we operate on a direct primary care model, which means no insurance hassles, no rushed appointments, just real relationships and quality care when you need it the most. Our mission is simple: to help you feel better and live brighter. We call it your Sunshine State of Mind, and we're here to help you reach it every step of the way. Thank you for trusting us with your care. We are so eager to walk this journey with you. Welcome to the Sunshine family.